Hi there, my name is Kobe Kingstrud and welcome to this video about my post-surgery drain. It is something that I've gotten a lot of questions about since having my top surgery, and I thought I would make a video about it. So this video is filmed vertically opposed to horizontally, which my videos normally are, but that's just because it allows you to see more of my body. So, wait, hang on. The lighting is acting up a bit. But anyway, before this video starts, I want to make a disclaimer that it is going to get progressively more gory, so if that's not your thing, feel free to not stick around all the way till the end. I will sort of start off with the least gory part and tell you why I have a drain in post-surgery, and then I'm going to show you how the drain works. I'm going to show you how I empty the drain, but I will keep you updated on how far along we've come and what gory parts you will see next. So for this first part, why you have a drain, you won't have to see anything, so you're all fine. By the way, I am not a medical expert by any means. However, I do have a drain in. I have had surgery, but obviously if you're going through surgery, ask your personal surgeon, because people do it differently. Actually, I'm going to sit down for this first part because I don't really feel like standing up. Plop down on the chair, and I'm ready to try and explain this the best I can. For those of you who don't know, I had a procedure referred to as keyhole surgery. In its entirety, it's called subcutaneous mastectomy, I think. Subcutaneous mastectomy, where mastectomy means removing or removal of the breasts, and subcutaneous means situated or applied under the skin. So with this particular form of top surgery, no actual skin is removed, and that is also why it's referred to as keyhole, because the incision itself is very, very small. The incision is most commonly made right under the areola, but no parts of the areola is actually cut off or removed, as once again, all of the removal is happening underneath the skin. Breasts aren't just two blobs hanging from your skin. The tissue sort of just spreads everywhere around your chest, so if I press here, it's very sore, same as here underneath my armpits to about like here. So although the incision is small, the area that has experienced trauma is quite big. So if you imagine my chest prior to surgery, it kind of consisted roughly of these layers. So it was my pectoral muscles and my muscles in general, and then it was my breast tissue, which mostly consisted of glands and glandular tissue, and then there was my skin. Now, since my chest was so small, it mostly consisted of glandular tissue, once again, as opposed to fat. And with fat, you can kind of just suck it out, as in like liposuction, but glands are much more rubbery and it's almost impossible to just suck them out, so they kind of had to carve it out from underneath my skin. And as I demonstrated earlier, they kind of carved out all of it in this area, which is, again, quite a large area. So since they removed the tissue that was between my muscles and my skin is sort of loose over that tissue now, which is why I have to wear this compression garment so that my skin and the tissue underneath can grow together now that everything that was between them is removed. But a body's normal response to such trauma is this sore liquid or sore fluid or healing fluid or whatever you want to call it. And if that accumulates under my skin and that sort of builds up between my skin and the tissue underneath that it's supposed to grow attached to, that fluid stays there, it won't heal properly. So what you have then is a drain that goes underneath your skin throughout the whole area and drains out the fluid. And I have a bag which the fluid goes into. Some people have asked me why I only have a drain on one side. That is simply because that's how my surgeon does it. I've seen some videos of people having one drain on each side where each drain sort of goes that much under your skin. But for me, my drain goes into my skin here, and then it goes 20 to 30 centimeters into my skin over to the other side. And it has all these little holes along the way of that drain so that it can slurp out fluids from all around my chest like a forbidden juice. Hopefully that explains your question on why we need drains post-surgery. Long story short, fluid buildup and the skin isn't able to grow attached to the tissue underneath, so we need to get rid of the fluid. Now, It is time for things to get a bit more gory, as I will show you my drain and explain how it works to you. So if blood is not your kink, that's not what I meant to say. If blood is not your thing, thank you for watching this video so far, and have a good day. Okay, I'll stand up now. Sorry if the lighting is a bit weird, but my lovely surgeon made it so that I can actually hang my little bag different places, which is why I was able to hide it in this video, as well as in my video talking about my top surgery experience. I just kind of secure this thing in my shorts, and then it's just been hanging from there. But usually I just wear it up here. Ta-da! And I also usually just pop this into my shorts, as well as the tube right here. And there you go. So, how the tube works. Don't be alarmed, first off, by all of this red stuff. I know that it looks like I have suffered massive blood loss. But most of this is just like the sore fluid thing that's been building up. But because blood is very pigmented, what it comes in contact with just sort of automatically turns red. Also, it's very normal for the fluid to be quite strongly red the first couple of days, and then it slowly turns more of a like yellowy, transparent colour. I can show you my whole tube, actually, and I'll show you where it's connected. Let's see. So what I also just mentioned regarding the fact that it'll be more bloody in like the first day, you can see it here already that it's a lot less bright red, and it's a lot, like the colour is a lot more yellowish. If you see right there. And that's also another thing to note, is that the tube isn't this thick inside my body. It is only like that, which is a lot thinner, and it only turns into this thicker one, like down here. Oops. You can see my butt now, and a little bit of my tattoo. It's my plague doctor's hat. I'm a plague doctor down here. Anyway, yes, so there's this thick boy, and then it just kind of meets this slimmer boy down here, and it goes all the way up here into my body, where they started removing the tissue. As you can see, I'm all blue here, and then it goes all the way across here. And here's my nipples, I think. I think this is where my nipples are. So, how this works is that, as I just told you, it goes into my body. There's this little ball right here, which when it is squeezed together, it functions as this vacuum, which sucks any fluid out into this little tube, further down the tube, and into this thing. Also, there's a bit of a gap between the liquids here. That's not an actual air pocket. It can't actually go into my body. I was a bit scared of that at first. I was like, oh, it's going to go back into my body. But if you see here, it stops where the big tube meets the little tube, so there's no issue. It won't go into my body. As this ball sucks, it will gradually fill up with my beautiful juices. So it is important that you squeeze out those juices into this bag gradually as it keeps filling up, because again, it needs to be squeezed together like this in order to have that suctioning function. So if it's filled up completely, it won't be able to suck things out. It won't have that vacuum because it will be full, which kind of makes sense. So, gore alert, I'm now going to show you how I empty it. There's not all that much fluid in it right now, so I'll insert a clip later of where it was 5 AM during the night after my surgery, and I wasn't able to sleep because I was in so much pain, and there was quite a bit more fluid in this. So I'm going to show you that later because maybe that's more interesting, but I thought I would show you how I do it while I do it and sort of just explain. So what I need to do first is I need to cut off this passage through the tube. So I have this little blue thing here, so it's open now. As you can see, nothing's pressing down on this tube, but I shall move this like this so that it cuts off this passage. It's a little bit gross right now, and you can see tiny little like bits of stuff, but don't worry about that. Now that you cut off this passage, and it doesn't really matter where you cut it off, just anywhere really, you need to open this passage into the bag. Now it's closed, as you can see, and you just slide this one into the opening, and now it's open. There you go. And now you just squeeze this ball. So once again, gore alert, watch this at your own risk. So you just kind of squeeze it into this one. It's quite hard as there's not a lot in it at the moment. There's some. Okay, I couldn't get much out of it, but to be fair, there wasn't much in it anyway, or like to begin with. So now that is in your little bag, you just shut this passage again so that this one can keeps its suction thing going, and then very important, don't forget to open this one so that it will have a free way to get into this ball and be sucked out of your body. Now when I've done that, I just hang it back around my shoulder because I much prefer having it there than flopping around on my thigh. And then when I have secured it, I just kind of tuck it back in. Oops. That's one thing that you shouldn't do. Make sure it is properly secured, because if this is heavy and it falls to the ground, it will like rip it out of your body ever so slightly. So I did that the first day, but luckily it wasn't filled with anything. But make sure that it is properly secured, or that's gonna hurt. Okay, there we go. I think it's fine now. And then you just tuck it back in into your shorts, like this. Now I'm going to show you what I do when I go to sleep. Oh, and by the way, I forgot to mention the reason why I have this bag. So the reason why I have to empty it into this bag is that you can use this to determine when you're going to remove the drains. So I measure how many milliliters are in the bag each morning at 11 AM. And then the first day, I think there was maybe like 60 milliliters in there. But then eventually, as the days go by, less and less fluid will go out. And when there has been an increase in 20 or less milliliters in the past 24 hours, you're ready to take the drains out. But yes, now I'm going to show you what I do when I go to sleep. When I go to sleep, I wear this shirt. Which yes is a Smith's shirt, and I have no shame. I really love this band, and usually my mom helps me get this over my head as I can't lift my arms very well, but I'm just gonna try it now just to show you. Okay, so I'm a little scared of ripping this tube out of my body whilst I'm asleep. So what I do is that I put this over it so that I will have no like access to this with my hands, and then just to be safe I tuck it into my shorts like this, and then there is nothing I can pull on. I have no access to what's under here, and the armpits are quite like tight, I guess. Well, not tight, but the armpit holes aren't that big, so it's not like my tubes are falling out on one side. Not that I move much when I'm asleep anyway now, because every position hurts, so I just lie on my back like this and try and go to sleep. But yeah, that's just what I do. Usually though, as it is the summer and it is quite hot these days, hang on, I just walk around like this. If my friends or anyone's over, I try to make sure that this is as hidden as possible, like including the bag, that it's not like, you know, just flopping around, making a lot of noise. Before I go, I'm just going to answer some quick questions from Instagram. Does it hurt? The drain does not hurt at all. I cannot feel the tube underneath my skin or in the insertion hole. It's all very numb. Is it heavy? No, there's not that much blood in the bag, so it's not heavy. Is the bag just hanging there, or is it supported? It is supported. How do you shower with it? I can't. I can't shower while I have it in, and I also can't shower until the holes are somewhat closed up, which will be 2 or 3 days after they're removed. Does it smell? No, it does not smell at all. I guess you need to change it, is that right? Not unless it like overflows with fluid, but that won't happen. When can you remove it? So as I explained earlier, you can remove it when there has been less than 20 milliliters that has come out of it in the last 24 hours, and that usually takes 1 to 3 days. The reason for that is they want to remove it while your chest isn't fully healed yet, so that nothing can grow attached to the tube, because obviously that would hurt a lot more pulling it out. Why are you bleeding still? Didn't they close you up? I don't get it. There's still a lot of fluid underneath my skin. They removed tissue from all over my chest. Is this frightening when you wake up with it, or did they mention it before the surgery? They actually didn't mention it before the surgery, I think. But I was prepared for it, and it didn't freak me out or anything. Are you bothered by it containing blood? I don't suppose so. Yeah, you're right. I think it's kind of cool. And again, it looks really dramatic. It looks like I've suffered extreme blood loss, but there really isn't that much blood. It's mostly just other fluids. Are you keeping the blood? Seems like something you do. I can't take it out of the bag because I need it to measure how much has come in the last 24 hours and also just in total. And I'm getting it removed by a nurse or like a doctor or something. And if I could remove it and empty it myself, I would keep the blood. But I don't think I will, since someone else will remove it. Does it itch? Surprisingly not. I can't feel it. Is it bad? It's really not bad. It's a little bit annoying with the tubes and everything, but I can't feel it inside my body. And once again, the tube isn't really that thick. It's only like this thick. As this video turned out longer than expected, I will upload me getting the drain removed as a separate clip. Obviously it hasn't happened yet, as well as the video of me emptying this into my bag at 5 AM as promised. Those will both be uploaded as separate videos. So thanks so much for watching, and I hope you have a brilliant day. And leave any other questions in the comments and I'll get to them. Bye!